That was so great to hear Anita's testimonial of how happy she was with the services she received from you, Dr. Hurst. How long has she been a patient of yours?
Probably 10 years, I think. It's been quite a while. We've developed a good friendship, and we've had a good time together.
I think that's really important because when you sit in a dentist chair, you feel quite vulnerable, and you know that they have sharp instruments that spin fast.
Yeah.
So and for me, you don't know what's going on, but it's nice to be able to develop that level of trust. Not only that you trust your skills, but also that you trust there's a relationship there. It's just comforting.
Yeah, it's nice to develop a relationship with people. I like to develop those relationships and become friends with them and have a good time.
Right. Well, it should be a good time.
Yeah.
So she had sort of a little bit of a unique case, which, rare condition that not a lot of people have, but because of your skill and expertise, you were able to point that out for her.
Yeah, well, we've done lots of work on Anita, and we've done crowns and root canals, but like you're talking about, she had external or internal resorption. Most people have external resorption. She had internal resorption, where you look at the X-rays and you find where the body is eating a hole in the tooth from the inside. Like I said, most of the time it's from the outside. You find that probably 20 or so times a year, the external resorption. She had the internal resorption taking place. The body gets mixed up and starts making a hole in the tooth. When we compare X-rays, and you see that, and you compare X-rays and over the years, and you say the tooth is starting to eat itself up from the inside. So we had to do a root canal on her and caught it before it ruined the tooth. If you let it go too long, it'll eat a hole in the tooth, and you'll have to have the tooth extracted. So we were able to catch that and do the root canal and stop that process. When you do the root canal, it takes all the blood vessels and nerves out of the tooth, and it stops that process, so it saves the tooth. Otherwise, you would lose it. So.
Well, I think what I get out of you telling me that is that you had a relationship with her, years of looking at her X-rays, so you were able to say, would not wait like a year after her being a patient of yours. You could say, we can compare this because you've been coming to me for a long time, and I think that was really beneficial for her.
We like to take X-rays every year, and we compare those. And when you see that, you can kind of look at it and say, that looks kind of strange. And you compare the years before, and you can see what's happening that way. So if you look at X-rays I've been working now for 29 years. It's been a long time. You just kind of see stuff. You can catch stuff pretty quick. So.
Well, we all know that the dentist is a great place to come for just getting your basic cleaning, getting your cavities replaced, but there's also sometimes you do a lot more extensive work than just the basic dentistry.
Yeah, I like to do complicated stuff, and I like to be able to catch stuff like that through my experience. Be able to catch those kind of things before they become a problem. And I like to do complicated stuff, not just the basic fillings and those kind of things. I like to do the root canals, the crowns, and the implants, and the gum surgery, and all those wisdom teeth, all that kind of stuff. I like the challenge of it. It seems like the more complicated it is, the more interesting it is.
Sure.
So.
Well, it's interesting you're saying all that, because a lot of times dentists don't do root canals, or they don't do difficult wisdom extractions, and it sounds like you can handle all the needs.
I like to do all that kind of stuff. It just makes it more challenging, more interesting. And if you're prepared, if you're knowledgeable, you don't have a fear about it, and I like that part of it,
Well, it's nice to be able to know that you can come to your office and know that you're enjoying your job, you like what you do, and that you can take care of all the needs of the patient. You're not going to have to refer them to somebody else.
Yeah. And people like it, because if I find something, say you're taking out decay in a tooth, and it's really deep and ends up going into the nerve, we can just switch a tray and go right into a root canal and continue with the crown prep after we get the root canal done. So the patient just stays in the chair. We just keep them, they're numb already, and we just switch from one thing to the next without having to stop and send them somewhere else. And people like that. So a lot of my patients come to me because I do a lot of different things, and they don't have to go around different places to have things done. So probably a lot of my people have chosen me because of that.
Right. And that's really great to know. Plus, you've been doing it almost 30 years. That's a long time.
A long time. I don't feel that old, but it has been a long time. And my dad worked till he was, my dad worked for 45 years, so my goal is to work for 50 years.
Oh.
My wife says I shouldn't go that long, but I'd like to go for 50 years.
Well, that's terrific. This is a great place to go to have confidence in your dentist and all your dentistry needs. Thank you so much.